Welcome back. It's 23 minutes after 9 o'clock. Now, traditional healers are said to be at risk of contracting infections from their patients. This is a finding of a Wits University study. It says healers are exposed to infections such as TB, COVID-19, hepatitis B, and HIV, but very few of them get protective gear. Well, to talk to us about this research and what's being recommended is Dr. Wagner from Wits University's School of Public Health. Dr. Wagner, good morning, and thank you very much for your time. You were the leader of this survey, which I understand you undertook in Mpumalanga province, in the Bushbuck Ridge area. First up, why did you find it necessary to do such a survey?
Sure. Well, good morning, Dan, to you and your viewers, and thanks very much for having me on the program. So traditional healers obviously form a very important group in South African society, and studies have suggested that up to 200,000 individuals, 200,000 traditional healers are working and living in South Africa. And right off the bat, we recognize that the term traditional healers encompasses a wide range of different types and different practices. And some of these practices include traditional vaccinations, which can include making incisions into the skin, which causes bleeding, and then rubbing traditional herbs or ointments into these wounds. And so obviously one of the questions that we had was, does this put traditional healers at greater risk for acquiring bloodborne pathogens, such as what you mentioned, HIV and hepatitis? And so, based in rural Mpumalanga, like you mentioned, at the MRC Wits Agincourt Research Unit, and partnering with the Kukula Traditional Healer Association of Bushbuck Ridge, we set out to look at, are traditional healers at greater risk for acquiring HIV and hepatitis?
So how many traditional healers were involved, Dr. Wagner, in this, and how did you select them, and what was the methodology? Just at a high level, what was the methodology used?
So absolutely. So again, we partnered with the Kukula Traditional Healer Organization, and so we used them, or we worked with them to identify the sample. And so we sampled their entire organization, which was about 300 traditional healers in all. And in total, about 230 ended up participating in this study.
Now, this was done between December 2017 and May 2018. And you found it necessary to release the results now during this pandemic, I'm sure for a reason.
That's right. So, it does take time in research to ultimately get the findings out. And part of that is because of the peer review process. And they're important findings. We did find very high levels of HIV amongst traditional healers, so upwards of 30%. Or 3 in 10 traditional healers.
And what's the normal HIV prevalence?
So the normal kind of national HIV prevalence for South Africa is about 20%. And when we talk about more kind of at-risk or high-risk groups, sex workers or men who have sex with men, oftentimes you will see levels approaching what we found in traditional healers. Now, so suggesting that traditional healers are a high-risk group for acquiring HIV.
And yeah, in terms of HIV, 30%, there will be concerns, therefore, about how they will be managing during this COVID-19 pandemic as well.
That's right. That's right. So obviously, if traditional healers, as they are continuing to practice and see patients, oftentimes they do it in small kind of enclosed quarters. So we would be able to suggest or hypothesize based on our work that there's likely to be an increased risk of traditional healers being exposed to and acquiring COVID as well.
Can protective gear assist them? I mean, traditional practices sometimes require people to use their bare hands, as an example, from what I understand. But to protect them, for example, from the coronavirus, HIV and others, they might need protective gear. Did you find that they are open to protective gear?
Very much so. Absolutely. So the vast majority of traditional healers that we spoke to were in favor of and actually did use personal protective equipment when it was available. The challenge that a lot of the traditional healers spoke about was access to personal protective equipment, such as gloves. And I mean, just as an example to highlight the importance they saw in this personal protective equipment, we spoke with a number of healers that would use either kind of disposed bread bags or supermarket bags to create a barrier, to put over their hands, to create a barrier when they were performing some of these traditional vaccinations. Again, just highlighting the value and the importance that they saw, as well as the risk that they saw in being exposed to blood.
So they would need protective gear, and they would also need to be given access to such protective gear.
That's right. That's right. And just to highlight a positive story, I mean, I don't think it's just us that kind of recognize traditional healers as a unique risk group during this COVID pandemic. South African National Parks has teamed up with rangers in the Bushbuck Ridge area, which is adjacent to Kruger National Park, and have provided masks and hand sanitizer to 3,000 traditional healers in the area. So the recognition of traditional healers as a unique risk group, both in terms of HIV as well as now more timely in terms of COVID, I think, you know, other people are kind of recognizing them as well. And I think the more that is spoken about it, the more that's recognized, the more that can be done.
And thank you for talking to us about it this morning here on eNCA. That's Dr. Wagner from Wits University about the survey that has been done and the importance of making sure that South African traditional healers are also provided access to protective gear. And they are very much open to it because they are at high risk as well of getting infected when they treat their patients.